Good morning and good afternoon, everyone. I'm pleased to welcome you all to the second webinar in the Implementation Science Collaborative's Evidence to Policy webinar series, which is focused on protecting children from violence. This webinar is titled Action and Impact, Using Data to End Violence Against Children in Africa. My name is Samantha Ski. I'm a Senior Implementation Research Scientist with University Research Co., and I'm also representing the Secretariat of the Implementation Science Collaborative, or ISC. I'll just share a little bit about the ISC before we get started. The ISC is a network of diverse global health-oriented partners positioned to respond to implementation challenges and address evidence-to-use priorities using a learning network approach. You can learn more about the ISC or sign up for our newsletter at iscollab.org. USAID has provided support for this webinar through the Health Evaluation and Applied Research Development, or HERD, project. Lots of acronyms this morning. And this webinar is led by two prestigious organizations serving as co-hosts. They are the East Central and Southern Africa Health Community, or ECSA-HC, and Together for Girls. ECSA-HC is an intergovernmental health organization that fosters and promotes regional cooperation in health among its member states. Together for Girls is an NGO and global partnership dedicated to ending violence against children and adolescents using data and advocacy. These co-hosts have put together a set of presentations and speakers for this webinar that will shed light on government efforts to implement national strategies to address and prevent violence against children. They'll give the perspectives of NGOs providing implementation assistance, and we'll also hear from government ministry representatives coordinating key elements of their national strategies. And so without further ado, I'd like to introduce our lead moderator for this webinar, Dr. Andrew Silumesi. Dr. Silumesi is the Manager for Family Health and Infectious Diseases with ECSA-HC. Dr. Silumesi, over to you.
4 presentations from our implementing partners. Following the presentations, which will be on the excellent work that they are doing in advancing efforts to end violence against children, we will have a question and answer session in which our presenters will be able to respond to some of your questions. And I encourage you to type your questions in the chat. We will then hear from government representatives from Kenya, Namibia, and Zambia as they discuss some of the efforts that their governments are making in responding to the issue of violence against children in their various country contexts. And to wrap up our webinar, we will receive remarks from USAID, which has invested immensely in supporting government efforts to address violence against children as part of its strategy of advancing protection and care of children in adversity. Without further ado, I'm so delighted to introduce our first speaker, Annie Ngujiri, who is the Senior Technical Advisor at LVCT Kenya. And Anne will share with us how her organization is enhancing child protection through support to national and county level children protection stakeholders in Kenya. Anne, over to you.
Good morning, good afternoon, good evening. My name is Anne Ngujiri from LVCT Health, and I'm proud to give the first presentation on enhancing child protection through support to national and county level child protection stakeholders in Kenya. Our journey towards ending violence pretty much started with our close collaboration with the Directorate of Children's Services when we were implementing the second survey in Kenya, the second national violence against children survey in Kenya, and the development of the National Prevention and Response Plan. Right from the onset, and even as we were publishing or launching these 2 documents, we identified that the government has 3 key priorities that they wish to accomplish immediately after the release of the NPRP. The first one was ensuring that at national level, all key policymakers, implementers, stakeholders, decision makers were well aware of the content that is within these 2 documents, which pretty much served as the blueprint in Kenya for ending violence against children. ensuring that these policymakers understood the strategies within these policies and were able to develop very deliberate work plans in the following years and budgets that are aligned to the activities within the NPRP as they were evidence-based. The second priority that the government had was at county level, now that Kenya has devolved counties, ensuring that the messages that are within the VACS survey and the NPRP actually reach the county level where a lot of the implementation was going to take place, and ensuring that even at county level, the same stakeholders had very clear work plans and budgets that would contribute towards implementation of approaches, evidence-based approaches to ending VAC in the specific counties. The third priority that the government established was ensuring that the coordination structures at national level and at county level were actually strengthened, so that every time the stakeholders met, it was very deliberate and meaningful towards achieving the 40% reduction that Kenya wanted to achieve when it comes to reducing VAC, and holding each other accountable when it came to implementation of some of the strategies listed within the NPRP. So to this end, and in close collaboration with the Directorate of Children's Services, Alve City Health implemented the Komesha Thuluma project with the intention of accelerating some of the government efforts by providing technical support and also facilitating knowledge exchange. Our objectives pretty much mirrored what the government priorities are. So the first one was to enhance national level coordination and implementation through the Violence Against Children Technical Working Group. And the whole idea with this was to ensure that there was unified efforts, there was buy-in right from national level when it came to addressing violence against children in Kenya. The second objective that we had was to have targeted dissemination of the VACS survey findings and the NPRP to policymakers from different sectors in the 3 select counties that we went to, that's Kirinyaga, Laikipia, and Taita Taveta. And the third objective that we had was to also extend the collaborative efforts to the county level so that they can also appreciate the content within the NPRP, what the government chooses to do, and how they can align their work plans with the NPRP. So what we have here are the 3 key objectives. At national level, what our main aim was to have buy-in from the highest offices, so that even as they're thinking of budget allocation, even as they're thinking of their own strategic plans at sector level, violence against children survey and the NPRP is always at the back of their mind, and that it's included in part of their work plans. So what we did very deliberately was do the dissemination of the VAC survey and the NPRP. We engage them to ensure that they're aware of the monitoring and evaluation framework, so that even as they cascade the information to their technical officers, they're very clear of the indicators that will be collected at national level for VAC and how they can be able to achieve those indicators at sectoral level. And what we also do is with the information that they gave us, we were able to develop an implementation matrix for cross-sectoral coordination to ensure that all sectors are well represented, even as you're collecting the achievements that have been done in Kenya when it comes to addressing VAC. Our second activity was at county level. Again, very deliberately, we started the engagements within the county children advisory committees. We started the engagement with the dissemination of the VAC survey and the National Prevention and Response Plan. During this meeting, we also got an opportunity for the counties to be able to share some of their efforts towards VAC, the types of violence against children cases that were reported to them through the CPMS. The children coordinator was also able to present on some of the efforts that they've made. And the whole idea with presenting the NPRP to them was for them to also appreciate what the document states and how they can align their activities to the NPRP. It was also a learning lesson for some of them, because they were able to identify some of the strategies that are there within the NPRP that they were not implementing. And this gave them a chance to be able to look at their own work plans and see how they can be able to fit in some of these activities. Another important aspect was the development of a costed work plan. For each activity that they listed, they were expected to come up with how much it's going to cost, what inputs are required, what are the outputs that they were going to achieve, and how does this contribute to the monitoring and evaluation framework for the NPRP. This ensured that, number one, there was no duplication of effort, even in terms of expenditure. Secondly, they were able to identify the gaps that are there when it comes to addressing VAC and give them ideas on how to further resource mobilize for some of the activities that they do not have funds for yet, but they would like to implement in the coming years or months. So primarily at county level, it was all about adaptation of some of the strategies that are there within the NPRP and ensuring that they are very well resourced to be able to be implemented. And then our third key activity was the development of the national level implementation matrix. Together with DCS, we were able to map out the key stakeholders that are expected to implement the approaches within the specific strategies in the NPRP. And even during the development of the NPRP, some of the stakeholders were already mentioned, and this included both state and non-state. And therefore, the meetings that we had in the follow-up to this development of the implementation matrix was for the stakeholders to be able to report back. Again, what have they been able to do? What have they not been able to do? What are the successes that they've had? What are the lessons learned? What are the challenges that they're having towards implementation of some of the activities within the NPRP? And how can we change the narrative so that it's not about challenges, but learning and moving forward towards achieving what you committed to in the NPRP blueprint? So the stakeholders had an opportunity to report on the key indicators, including the VAC cases, prevalence changes, accessibility of protection services, the number of service providers who have been trained and what they have been trained on, how many children are seeking social protection services from the various stakeholders. It really gave us an opportunity to look back, almost like a midterm review. It gave us an opportunity to be able to look back between 2019 and 2023. What are the achievements that we've had, and also look forward and start planning for some of the activities that have still not been achieved, so that we can be able to better plan for them. On the screen is a whole list of key stakeholders and actors. I think for us it was to just be able to demonstrate how deliberate we were when it comes to engaging stakeholders in the journey towards ending VAC. We had this at national level and across the 3 counties. Again, the stakeholder mapping was very deliberate to ensure that all the people sat around the table were influential and all the activities that were listed could be implemented by the stakeholders. We ensured that all the key sectors were represented, right from health, police, security, education, the development partners, the civil society as the non-state actors. We had the media, the religious leaders, anybody who did any work towards child protection, from awareness to actual interventions like life skills. All of them were brought together during the county level engagements and at the stage where we were completing the implementation matrix, so that we can be able to appreciate the collaborative effort that it takes towards ending VAC, and also just to get to understand some of the things that they're actually doing that we could report back in the implementation matrix. So these are some of the achievements that we were able to see. There was enhanced data sharing. There was a lot of learning, and particularly at county level. Some of the things that might not necessarily be disseminated in the traditional ways like journals or blogs, we were able to hear some of the stories that actually were documented in the implementation matrix in terms of what they've done to achieve the changes towards the reduction of VAC incidences in the community. So there was a lot of learning, data sharing and learning. Bringing stakeholders together also enhanced collaboration and coordination through the county children advisory committees and through the VAC technical working group at national level. And again, this brought stakeholders to appreciate that each one of them has a role to play in their own way, but all contributing towards fighting violence against children in Kenya. And also because we are always referring back to the NPRP, whatever approach that the members took in when we were discussing the implementation matrix was action-oriented and evidence-based. And we ensured that the costed work plan was something that was disseminated back to the national levels, back to the heads of the ministries, departments, and agencies, as well as the county children's coordinators, so that we ensure that whatever was there is actually going to be achieved in the coming years. So even as we departed from the counties and even as we still continue with the national level engagements, there's quite a lot of learnings that we had from there. We have the technical working groups which bring stakeholders together. We have the county children advisory committees that are present. Members, however, stated that there needs to be a very clear engagement plan so that to ensure that the coordination is meaningful, that we are all working towards the same goal of ending VAC, and how to bring on different stakeholders, ensuring that there's a very well and good representation of stakeholders, that the space is inclusive enough to be able to discuss the VAC prevention agenda. We also need to promote coordination and collaboration to ensure that there's a shared vision and commitment amongst all the state and non-state stakeholders. Another lesson that we learned is on enhanced information sharing and knowledge management. There needs to be very deliberate efforts towards documentation of our efforts in VAC. A lot of the stories that we were collecting, or a lot of the findings that we were collecting, are not things that have been very well documented. So even when it came to completing the implementation matrix, there were difficulties because actors, implementers are doing very well at community level. They're able to report back verbally, but then when you need the evidence to show the achievement, it is lacking. So there needs to be very deliberate effort in how to build capacity on documentation and how to build platforms or to facilitate platforms where people can be able to share some of their learning, some of their achievements, even beyond the county level. When it came to completion of the national matrix, again, another challenge that we experienced was the reporting mechanism even at county level. We have the CPIMS, but we also appreciated that for perhaps some of the non-state actors, they have their own reporting systems that might not necessarily feed into the CPIMS. So there needs to be a way to bring all this data together so that even at national level, as that data is fed up, we can say that this is an actual representation of all 47 counties, all the partners, all the state actors when it comes to addressing VAC. That seems to be lacking. So there's a need to establish a comprehensive and robust reporting mechanisms that brings all the data from all stakeholders together, both state and non-state, so that meaningful decisions can be made using this data. The issue also came up on allocation, budget allocation. There's too much activities, there's too little to be able to sustain some of those activities in a manner that makes the activities impactful. A lot of the activities that were being reported seem to have been one-off activities. And in VAC prevention, there needs to be that sustainability in some of these activities, right from awareness creation at community level so that we can change norms, to coordination structures at national level so that we can ensure that the information sharing is sustained throughout. So there was a lot of push towards advocacy for long-term sustainable budgetary allocation, specifically earmarked for child protection initiatives at county level and at national level. And again, another one of the activities was, another lesson that we learned was aligning child protection strategies within existing social welfare programs so that VAC is not looked at in silo. It happens in the same space where violence against children happens. It happens in schools, it happens at home, it happens in communities. It's perpetrated by peers, fellow peers, and adults in the community according to the survey. So it's important then to ensure that when you're talking about community level initiatives, conversations on violence against children are included in that. When you're talking about mental health, conversations on the effect of VAC on mental health of children and their well-being is included in that, rather than working in silo. So there was a push towards aligning child protection strategies with existing social welfare programs to address the whole issue of VAC comprehensively. Well, I'd like to thank you, the USAID HUD team, the URC, the support that we got, and most importantly, the Directorate of Children's Services, who we worked with and we continue to work with very closely as we address violence against children in Kenya. Thank you very much.
Thank you very much, Annie, for that very informative presentation, really highlighting the great work that is being done in Kenya in supporting the stakeholders that are active in preventing children from violence. Our next presenter is Penina Jerono, also from Kenya. Penina is the Project Officer, Child Protection and Participation on the World Vision Kenya Big Dream Program in Samburu County. Penina's presentation also will focus on enhancing child protection through support to national and county level protection stakeholders in Kenya. Penina, the floor is yours.
Good afternoon and also good evening. My name is Penina Cherono from World Vision, and I'm here with my colleague Alex Kariuki, who is the Senior Manager for Child Protection as well from World Vision. So I'll be speaking about enhancing child protection through support to national and county level child protection stakeholders in Kenya. So I'll just give a brief introduction with funding from URC, that is through the USAID-HC project. World Vision Kenya implemented a set of activities in relation to combating violence against children. So as outlined in the Kenya's National Prevention and Response Plan to end VACS. And also in line with that, the priorities of the government of Kenya, World Vision Kenya supported the Directorate of Children's Services to share the findings of the VACS and also youth survey. And that one aimed at increasing awareness of the NPRP, which was informed by the Violence Against Children survey, also to support contextualized county prevention and response plan, and at the same time strengthen the coordination of VACS intervention in Kenya. So some of the proposed approaches under the HAD project included dissemination of VACS survey report of 2019, and also the NPRP plan of 2019 to 2023. Another approach under the project was to strengthen coordination for implementation, data collection, monitoring, and reporting for NPRP on VACS. So we had a number of partners. The key partners that we had on board is the Directorate of Children's Services, that is within the Ministry of Labor and Social Protection. We also had Children Advisory Committee members. These are members drawn from the different government stakeholders, both state and non-state actors. We also had LVCT Health, USAID, and also the communities whereby we disseminated the Spot It, Stop It campaign. We had a number of activities done at the county levels. So in Kenya, we had 6 counties whereby we rolled VACS and also Spot It, Stop It campaign. That is in Samburu County. We also had Nyeri, Narok, Marsabit, Wajir, and Lamu counties. And for those activities, it involved dissemination of the VACS and also NPRP. We also had action planning support for the different counties, and also we conducted Spot It, Stop It campaign in the respective counties. Another activity that we did, we also supported periodic meetings and the county technical working groups, which also involved the children advisory committees on VACS, so that we could review and also the implementation of the status of strategic action by each sector, that is within the NPRP. Also analyze and discuss implementation efforts, the trends, and also emerging issues. Another activity that we also conducted is that we held strategic engagements, meeting to develop an aligned national and county level NPRP implementation matrix and work plans. We also had other achievements, quite a number of achievements. We successfully disseminated the VACS report to the county child protection stakeholders. That is in the 6 counties that we rolled out in Kenya. As earlier mentioned, that is Samburu, Nyeri, Narok, Wajir, Lamu, and Marsabit, and also distributed the posters on NPRP and VACS. Another achievement is that we were able to review the VACS survey report and NPRP presentation, that is in view of the new law for the children in Kenya. That is the Children Act 2022, which came in place in July the same year. And also we were able to review other emerging trends relating to children. Another achievement is that we were able to support periodic meetings of the county technical working groups to review the implementation status of strategic actions by each sector within the NPRP. We also analyzed and discussed implementation efforts, the trend, and also emerging issues on the same. We were also able to develop key messages on VAC, targeting the relevant stakeholders. Another achievement is that we successfully launched the Spot It, Stop It campaign in the different counties, the 6 counties, whereby we were able to share the key messages on VAC presentation and also had children participate. So we had meaningful children participation during the campaign because it touches on them. So we're able to empower them and capacity build them, and also for them to know what Spot It, Stop It campaigns. So that was done in all the counties whereby we launched the VAC report and also Spot It, Stop It campaign. We had a number of celebration about increasing awareness of stakeholders and also community members. So community members were enlightened on child protection. We were able to tell them what child protection entails, what are the prevailing child protection issues in the community, and how to report the child protection incidences. Also, community members are committed to end violence against children and also report all the child protection incidences they come across. Another thing that we're able to celebrate is that there was an active participation of community members whereby they expressed interest to learn more on NPRP and what their specific roles were. We also had border riders. Border riders are the motorbike riders who were able to participate in community engagement meetings, whereby they promised to be agents of change in helping end VAC. Another celebration that we have is about child participation, and I can say that this was very informative because the children were able to contribute to the discussions we had, and also they had an opportunity to share with the adults on the issues that affect their lives and also how they feel about the harmful cultural practices. From it, we also drew a number of lessons. And one of the lessons is that about convening entry meetings, especially to the communities and also to the stakeholders, and also having joint work plans as stakeholders, clarifying the roles and responsibilities before implementation of VAC strategies. So that was a very key lesson that we learned because it all contributes to VAC and also Spot It, Stop It campaign. Another key lesson is that there is need for orientation of child protection stakeholders on the INSPIRE approach so that we can have proper development and also realignment and execution of NPRP activities among other responsible sectors, because for INSPIRE approach, it covers all the responsible sectors or all the responsible partners in child protection. We also had another lesson, a key one about Spot It, Stop It campaign and sensitization of local stakeholders on VAC and also NPRP, because it's very instrumental in ensuring that the local child protection actors, both state and non-state actors, work jointly in a collaborative effort to address VAC. We also conducted periodic meetings to track plans of the technical working group that we had in place so that we can ensure that it's in line with the VAC findings and also ensuring that it's in line with the Spot It, Stop It campaign. Another key lesson is to monitor and do evaluation, which is very key. This one ensures implementation of the specific sectors' activities in addressing violence against children and also implementing NPRP. Another lesson is on documentation and sharing the best practices and information in addressing VAC. That is by partners because it's very paramount to contributing towards improved knowledge from the different partners and also from the different actors. Another key lesson is that for VAC to end, it requires a multi-sectoral approach. So it is very important to have all the relevant partners, both state and non-state actors on board. So our takeaway is that we have an overall takeaway or moving forward. We need to have an advocacy or advocate for children to VAC and also NPRP at the national and also at the county level, so that we can ensure the government commits more resources towards ending violence against children and implementing NPRP. Also, we need to strengthen the multi-sectoral approach to implementing NPRP so that we can have all the actors on board. We also need to convene quarterly reflections and also review meetings so that we can monitor the sector-specific NPRP implementation. And we also have to publish a status report on how well, as a country, we have been able to implement NPRP, considering that NPRP was a plan between 2019 and 2023. So we need to have a report, a published report, so that we can be able to see how well are we doing or how far are we. So in the counties and communities, we need to convene periodic meetings. That is with the county technical working groups involving advisory children committees to review NPRP implementation by different stakeholders and actors, and also the different sectors. We also need to support county assemblies so that they can develop children policies aligned to NPRP, considering that it was a plan which succeeded the Violence Against Children survey. So we need to support the county assembly so that children policies can be developed and aligned to NPRP. Also, we need to prioritize grassroots dissemination of VAC and also NPRP. That means from the lowest level, which is the village level, coming upwards to the ward level, to the sub-county level, and going all the way to the national level. So, but our priority is to prioritize grassroots dissemination and also have community engagements on reporting and referral of VAC incidences. Another thing that we need to do moving forward is organize community campaigns widely. That is include an ongoing campaign message on ending VAC at the local radio station and also TV stations and social media, so that it can be a continuous process, so that we can achieve the objectives in the NPRP and also Stop It campaign. In support of child participation, we have to support the county, the governments, so that they can develop child participation guidelines in line with Section 28 of the Children's Act, and also develop child-friendly materials and community-based feedback mechanism on VAC. So as I conclude, I'll share a success story from one of our beneficiaries in a community whereby we conducted Stop It campaign and how it changed her. Even later on, how did it influence her decision? How did it affect her, and how is her perception on child rights and also on ending violence against children? So I'll invite you to watch the clip.
Samankara mela unaginkara abu bambi kumonkara mbido dwada barabara nigi ntekes nigi sia lo mela ni amra nto ya gide jo meto nigi amra nto ye amko nga gitu ngapa lomon kena mukutano ngo rajo ni sibat marata kering to yosib kaina ta ashawleng wal division ora ri ko kala ngapa poku o dikito na joga al division poku lo tungana poka pa lo ti nyapar nyakita shoto ashawleng amu ya kita yoro man supati aya ki yo ndo ka bagna reti yo to do bagna je kere tapa bagi yo kere ti yo nya na ko ka tinyo na shit na jo ngai tere.
Thank you so much. I hope you've been able to follow through. That is a lady who was able to be transformed And she has talked about bidding. Bidding is one of the forms of preparing a girl to be married off. So she was able to change that perception and take the child who's a girl to school. So she has also mentioned that she learned about the reporting mechanism and referral mechanism. And she's really grateful that we had the Spot It, Stop It campaign because they've been enlightened and they know the different forms of violence against children. So I'd really like to thank you. Thank you so much for the support from HAD, that is Health Evaluation and Applied Research and Development. And also I want to thank USAID and also all the other partners who made this possible. Thank you so much.
Thank you very much, Penina, for that very informative presentation. Just to remind all your participants that there is a provision for you to type your questions. And in the chat so that our presenters will be able to respond to them later. I have the honor and privilege to introduce our next speaker, who is Nicolette Bessinger. Nicolette is the director at Lifeline Childline in Namibia. And her organization has been working with the Namibian government to contribute to ending violence against children through strengthening the national parenting program. So let's hear more about this from Nicolette. Nicolette, over to you.
The focus of my presentation is on strengthening the parenting and caregiver interventions in Namibia. The presentation includes the following: the importance of the VACS data, project objectives, IEC materials, VACS recommendations, some accomplishments, upcoming activities, opportunities, and key lessons learned. Through the VACS study, an opportunity was created for Namibia to address the violence against children. It focused on the immediate and future prevention initiatives and response programs, which include schools and communities. It also created an opportunity to further foster partnerships with different entities. Prior to the VACS study, Namibia convened a national conference in 2014 on GBV. At this conference, they came up with similar findings as was found in the VACS study. It also included the establishment of the Lifeline Childline toll-free GBV helpline 106. In the Namibian context, through the agreement with Ministry of Health, Ministry of Gender, and Lifeline Childline, the following key components were considered to achieve the objectives to reduce the violence against children. And these objectives include building resilience, preventing behavioral issues, addressing specific challenges, promoting healthy child development, to educate parents that corporal punishment causes trauma, cultural sensitivity, supporting parents with challenges of raising children, supporting government initiatives, enhancing parental skills, and promoting the safety of the Namibian children. The following IEC communications and materials were developed in consultation with the technical working group, based on the outcomes of the VACS study to implement and support the parenting program. The following IEC materials were compiled: presentations on wills and inheritance developed by the Legal Assistance Center, Parenting Caregiver Handbook and Facilitator's Guide, radio talk shows, messages from the VACS and parenting data collected, printed brochures, also a simplified document on the Child Care and Protection Act developed by Legal Assistance Center, video infomercials, and radio jingles. All the IEC material amplifies the recommendations from the VACS study. Messages were developed in consultation with the technical working group. Here we have the different accomplishments through the HEAD project. We established the technical working group. We developed a national parenting strategy. We did the orientation of the technical working group on the revised manual, the training of the facilitators on the draft handbook. We conducted a costing workshop of a national parenting program in collaboration with line ministries and civil society organizations. We also further conducted the training of facilitators, the training of parents on the National Parenting Training Manual. We conducted data verification visits to the selected communities. We completed the M&E framework, and also the IAC materials are completed. Lifeline Childcare Namibia assisted the Ministry of Health with the finalization of the National Parenting and Caregiver Handbook and the Facilitators Manual. The final version was approved and accepted by the Technical Working Group in September 2023. The focus of the strategic plan that we completed with the Technical Working Group is based on the following pillars under the guidance of Ministry of Health and Social Services. It includes the legal framework and guidelines, advocacy, public awareness and coordination, capacity building to enhance the capacity of stakeholders to deliver effective parenting support, family support services, monitoring and evaluation, research and development. As the technical partner working with the Ministry of Health and Social Services and the Ministry of Gender, Equality, Poverty Eradication and Social Welfare, the required documents were completed in support for the Ministry of Health to further engage with the senior management for the final endorsement. This is just a listing of all the completed IEC materials. The Parenting Handbook and Facilitators Guide will be printed in the first quarter of 2024. Some of the challenges experienced during the project are the following. Firstly, every project in general can do more work with a bigger team. It is important that relevant stakeholders are involved. However, due to equally important tasks from different organizations, it was quite a challenge to convene with everyone at the same time. Due to various technical reasons, the capacity was a major need. And here I'm referring to the financial and human resources. Members volunteered on this assignment, which very often delayed some processes. Considering the limited resources for the implementation of the parenting program, be it a 5-day training or a topic-specific training, if no increased resources are mobilized, sustainability is hampered. Time constraints remain a challenge for a project of such magnitude. The project yielded the following opportunities, such as creating more awareness of the Child Care and Protection Act amongst parents. More facilitators should be trained to sustain the parenting program, including social workers from the different ministries, Lifeline Childline trainers, and other interested stakeholders. Ministry of Health will be responsible to coordinate all the training on the parenting in Namibia. This is to ensure that the curriculum of interested partners are aligned with the National Parenting and Caregiver Handbook. More funding should be secured for the printing of materials for the parenting program. It is also important to engage in continuous efforts to enlarge the parenting body of knowledge in Namibia. It is also important to engage the lawmakers of the country to improve the safety of the children in Namibia by urging parents to take up their roles and responsibilities. Herewith, the key lessons for similar projects. Start by defining the parenting objectives and conduct a needs assessment. Establish a technical working group. Involve and collaborate with stakeholders. Develop a plan. Set realistic timelines. Conduct a risk identification. Important to establish technical working group and stakeholder communication channels. Also involve parents and children in the program design. Recognize and respect cultural sensitivity and inclusivity. Collect regular stakeholder feedback. Tailor the content to the different parenting stages. Material and content of parenting manuals should be inclusive engage parenting experts, promote practical parenting skills. For monitoring and evaluation, include lessons learned. Consider all key lessons learned from this project. It is important that financial resources should be sufficient. I herewith acknowledge the funding agencies and institutional support we received, all the technical working members for their contribution throughout the period, the stakeholders who attended most of the meetings, the collaboration between partners and institutions, including the local authorities, the expert and consultants, FPO, faith-based organization communities, the schools, and all other agencies. It was a great experience working with this project. I thank you.
Thank you very much, Nicolette, for that very informative presentation. And it's great to see what is happening in Namibia. Our final presenter is Robert Pendapala Haihambo, officer at Project Hope in Namibia. Robert will share with us how his organization has been working in Namibian schools to strengthen violence prevention.
Hello, my name is Robert Pendapala Haihambo. I'm an Economic Strengthening and Public-Private Partnership Officer at Project Hope Namibia. In the past 2 months, I've been working in the Country Director's Office at Project Hope Namibia in Windhoek, Namibia, to assist in coordination of programs. So I help, or I coordinate programs that Project Hope Namibia is involved with here in Namibia, in Malawi, and in Egypt currently. The VACS program is one of the programs that I've been assisting, or I've been coordinating in the past 2 months. I've taken over from a colleague of mine who left at the end of September of this year. So I'm going to do a presentation on the strengthening violence prevention capacity in Namibian schools, supporting government efforts to address and prevent violence against children in Namibia. Let's look at our table of contents. This is how it looks like. I'll be looking at the objectives of the project, the role of data, what data informed Project Hope Namibia and partners to initiate this project. We'll look at key partners that we've worked with, key activities and results, baseline thesis, endline survey results, next steps, the key lessons learned from the implementation of the VACS Ahead program, and then some acknowledgements at the end. Let's jump right into it. So we have about 3 objectives of activities that we've implemented. Objective number 1 was to build the capacity of teachers from selected schools to effectively prevent and respond to violence and self-harm. Number 2, to develop and pilot an electronic case management system, ECMS, for violence against children, including GBV. Finally, the objective number 3, to develop and disseminate a case study describing the learning and the results. We move to the role of data. Which data did we look at, or which data informed this program? Mainly, the program was informed by data from the 2019 Violence Against Children VACS survey, which was done in 2019. Some of the key findings from this survey was that 39.3% of girls and 30% of boys experiencing emotional violence inflicted by peers. This is the most common form of violence experienced by children. The survey further on continued to find that 4 in every 10 females and 9 in every 20 males have experienced physical, sexual, or emotional violence in childhood. The survey furthermore found that 4 in 10 boys and 3 in 10 girls are physically abused before they turned 18 years old. We continue with the data. Shows that adolescents in the age group 12 to 17 have experienced the most physical violence, with 2 in every 3 females and 8 in every 13 boys reporting that they have experienced physical violence. The survey further went to find that peer violence is the highest form of violence experienced by children in Namibia, with 39% of girls and 30% of boys experiencing emotional violence. More findings from the 2019 VACS survey found that, and the research has shown that children are usually abused by people they know. This could be parents, it could be neighbors, teachers, intimate partners, or their peers. It has also found that early identification interventions and continued follow-up are valuable strategies to prevent or decrease the impact of exposure to violence. It also suggested that violence on children causes emotional scars that often lasts much longer than the physical scars have faded. So the emotional impact is felt long into the future than the physical scars. Lastly, the research has also demonstrated that children who are victims of violence are more likely to abuse other children and to carry this violence behavior into adulthood. We move on with the key partners. So since this is a multi-sector approach, and it required various partners on board to ensure that this is a success. So Project Hope Namibia, through the funding from Health Evaluation and Applied Research Development Head, directly supports the nodal agencies, which is the Ministry of Gender, Equity, Poverty Eradication and Social Welfare, and the Ministries of Education, Arts and Culture, to improve the capacity to respond to and prevent violence in the school setting. Moreover, Project Hope Namibia will strengthen existing collaboration platforms, including the multi-sectoral GBV team and School Health Task Force, and build on the DREAMS partnerships with other head partners, which is the Lifeline Childline Namibia. Key activities. We move on to all key activities that the program has implemented. We will not look at all of them, but I will just highlight. So, for instance, some of the activities were stakeholder meetings, selections of schools for the pilot, conducting baseline assessments, support the development of action plans, selecting of TOTs, training of teachers from selected schools. So about 28 schools were selected, and the number of schools that were reached were 478 out of the total 532. That was about 90% of the initial set out teachers to be reached. The program is also procured tablets to be used for the ECMS. Those are about 43 tablets were procured. We move over to the key activities and results. Some of the results also that we have had in the program shows that some of the ECMS was developed, the system was developed. Teachers were trained on the ECMS, and also follow-up assessments have been done, which this was the baseline assessment that was done for the 28 schools. Apart from activities that have been done and progress and results have been seen, there are more activities that are still in the pipeline, but there is some level of progress in that. This includes the end-line survey data analysis. End-line surveys have been received from schools. End-line surveys have been entered, data has been entered, and analysis have started. And the end-line survey results have come from 19 out of the 28 initial schools that did the baseline survey. So out of these 19 schools, these were about 519 learners, and 228 parents that responded to the survey. A case study is also to be developed. 9 case studies have been received from the schools. They've been submitted to URC to support with analysis of these case studies and to ultimately select or develop a manuscript, which is then to be disseminated. 2 other items that are on the pipeline is refresher trainings and handover of tablets. Refresher training on ECMS system and handover of tablets. These 2 events are to be done concurrently or at the same time. Basically, when the resources are available to conduct this refresher training and to hand over the tablets. We move over to the baseline versus endline results. How does the results look at endline vis-a-vis the baseline? So most of the results at endline have shown an improvement. As we can see here, we have a chart that shows the perception of safety at schools by learners. You can see in blue is the baseline, in gray is the endline. And all the nodes, we see that the endline has improved vis-a-vis the baseline, except for question 5, which asked, you feel you are able to get help from the school if you feel unsafe. So the baseline, the endline is behind by 1%, 8% compared to 69% at baseline. And this might be because the children have understood better the definition of what violence against children is, and perhaps they've found that some of these services are not available at their school. And that is why we lagged at the endline vis-a-vis the baseline. We move over to the next steps. What are the next steps to get the agenda across? We need to finalize the analysis of the endline data collected and also the case study analysis, so we can develop and disseminate the manuscript to ensure that there is operational ECMSs so that the VAC violence against children cases are reported, and then also to build the VACS agenda into existing platforms such as the multi-sectoral GBV teams. Moving on to the key lessons learned. What are the lessons learned? Agenda for addressing violence in school should include teachers, so that those teachers that experience violence in their formative years can also be supported. VACS-related interventions require long-term interventions. Therefore, the project duration of 1 year is not sufficient for efficient implementation. Also, the training taught teachers that about the risk of corporal punishment and why it should be avoided, but training in an alternative, positive forms of discipline is also needed. Lastly, we acknowledge acknowledgements. We acknowledge the support from the Health Evaluation and Applied Research Development Project, which is funded by United States Agency for International Development, USAID, under that cooperative agreement. The project teams include the recipient, prime recipient, which is the University Research Corps, LLC, URC, and then sub-recipients. The information provided is not official US government information and does not represent the views or positions of USAID or the US government. So this marks the end of my presentation. Thank you very much. Goodbye.
Thank you very much, Robert, for that very insightful presentation on the work that you are doing in Namibia. And thanks to all our presenters for the very informative presentations that have been made today. At this point in time, I have the pleasure to introduce my co-moderator, Manuela Ahogo, who is going to join me to moderate the question and answer session. Manuela, over to you. Please take it up.
Thank you, Andrew. And good afternoon, good morning, everyone. I would like to echo Andrew and thank our presenters for the excellent presentations and congratulate the respective organizations' commitment and impactful activities to end violence against children. I'm particularly fascinated by how each organization and country stakeholders draw on data and evidence to design interventions and projects through a multi-sectoral approach and ensuring grassroots engagement. Now we will take some questions submitted by our audience in the chat box. So maybe as we wait for the questions to come through, it was great to really see that, how each organization, describe the process of community engagement. But maybe I want to turn to our presenters and ask how important VACS data were in mobilizing stakeholders to act in violence prevention. Maybe I'll start with, I'll start with Anne from LVCT.
And may I encourage our presenters to just switch on their cameras so that we can see them as they respond.
Thank you, Manuela. Please confirm you can hear me.
Yes, very well.
And for us, the VACS data was very important. We were cognizant that some of the stakeholders or the implementers that we're having right now did not participate in the first VACS survey in 2010. So to be able to present to them nationally representative data on how violence is affecting children was the first time in them recognizing that it's an issue before they start thinking of strategies on how to address it. So having those numbers was important from the onset, and that's why we did deliberate dissemination of the VACS survey to all the communities, to all the stakeholders from national level to county level. So you give them that level of, we have something to work on. We have numbers as baseline that you can contribute towards reducing by the deliberate actions that we have. The VAC data also helped us the second way because we developed our national prevention and response plan based on the issue that we had at hand. So the VAC data was able to help us identify the context in which VAC occurs, the issue of the gendered perspective of it, the age variation, age-based variations with it, so that even as you're going to the community and telling them you need to do school prevention programs, it was very deliberate for which cohort, for which gender, for which age group. If it's at community level, the VACS data was able to tell us, for example, that children consider parents as the biggest perpetrators of emotional violence. So it sort of helped us focus our interventions very deliberately. And this is a story, or this is a narrative that we also went with at community level, that these are the numbers. If you want to address these numbers because it's what the VACS data is telling us, then these are the interventions that you have to apply. So it was very, very useful in the conversation towards ending VAC and developing the National Prevention and Response Plan. Thank you.
Fantastic, and thank you so much. Maybe I'll have the same question for Nicolette from Namibia, and then I'll turn to the question from the audience for our others presented. So Nicolette, on the importance of VACS to mobilize stakeholders.
Hi, afternoon, everyone. Yes, it's important that through the data that we collected also builds on the credibility. So it's important that we build credibility with our partners and using the VACS data that we have. It also provides an opportunity for advocacy and communication that needs to be developed with the partners and in the programs that we'll be developing. And also through the VACS data, it helps to influence policy development, because there's a number of policies that we need to also still consider, in particular referring to the parenting program that we've presented to this webinar here. And it's also obvious then to be able to measure the impact. So it's important that we take the data and we further develop it in the country with the different programs that we're implementing for awareness raising. So it really helped a lot with the awareness raising. It increased the understanding among stakeholders and the communities, and for planning and also for targeting resources effectively. So data has really been, the VACS data has really helped us to focus, and the study has helped us to focus on particular issues that we need to focus on and that we need to plan on. Thank you.
Thank you so much, Anne and Nicolette. And I'll turn to the World Vision team, so Penina and also Project Hope, Robert and team, on this question coming from the audience. So we have a question which asks about the challenges with data collection particularly around the sensitivity of the issue of violence against children and avoiding underreporting? How do we mitigate that?
Thank you, Manuela. I'm with my colleague, Alex. I think you will take up that.
Thank you, Manuela. Confirm you can hear me? Okay, thank you.
Yes, very well.
Yeah. Okay, thank you. I think that is a very pertinent question because when you go to communities and when we are working with the communities, some of these communities actually may not even have information on the nature or the prevalences of abuses happening to children within their communities. And so how this has helped is that, first of all, when you give the community the information, they see the seriousness of the issue, they appreciate the vulnerability their children are in. And then from there, they make commitments. Like you listened to the lady who was saying that after the Spot It, Stop It campaign, she was willing to go out there and even report cases of child abuse. And she said, actually, her own daughter was bidded to be married off. But after getting that information, she reversed that decision and said her daughter has to go to school. So I think this information is important. And as you saw in our presentation, the communities out there actually were enlightened when we talked to them about the violence against children information and also the National Prevention and Response Plan, what is supposed to be happening, the 7 strategies that we had adopted. And one of it was even reporting, even helping them to understand where they should report, including the children themselves, having an understanding of how they can actually be able to speak out on issues that are affecting them. So I'll say that for the data, it is important both for information and also for action. Thank you.
Thank you so much, Alex. Over to you, Robert.
Thanks for the question, Manuela. Can you just repeat it again?
Yes, sure.
I'll answer, then I'll give my colleague Matt Shindi, who's also here, to perhaps give his perspective since he deals with the data. He's the one who was dealing specifically with the data collection and analysis. Yes. But please repeat it, then I'll answer.
Yes. Yes. So the question asked is, what are the challenges with data collection, especially when dealing with the sensitivity of the issue of violence against children, and how do we mitigate underreporting?
Mm-hmm. Yeah, I'd say from my experience, I've seen that dealing with the data that we've been getting and the challenges that we've been getting from the participants, I think one was one of the challenges with the data was the language barrier. We had a bit of a language barrier. We go into certain regions, people who don't understand English, and thus we had to really be able to, the teachers, the life skills teachers that were trained to get these questionnaires or get the answers, correspondence from the people in the regions. The very deep regions, people who could not understand English, were really struggling at the very beginning to be able to translate and get the information out in the various vernaculars, various languages that people spoke. Even this, though this was a challenge at the beginning, later on it improved because we were able, some of the teachers were able to get other people that will speak the languages and translate the information on the questionnaires that we had into English. So that was one of the challenges at the beginning. But also, I think in terms of getting the actual data, some of the issues, the violence, some of the violence against children issues, or some of the questions, people were not responding to perhaps with all honesty, because in some of the cultures, some questions, for instance, seemed like they were normal. For instance, if you say, have you been abused? Do you get bullied at school, for instance? If you ask a child, do you get bullied, for instance, in a certain region, they will say, no, I don't get bullied, because to them, that is normal. They take it as a normality. So the issue of violence then to some of these communities It's really it was really a perspective of what is it? How do you define violence? What is violence to you? Is an insult a violence, for instance? If someone calls you a name, is it a violence? So some children really thought that that is normal. If it's name calling, we are used to it at school, so that is not violence. So they would perhaps respond to say, no, I did not experience violence in my life, while they had experienced violence. So it was really a matter of getting the information out first, making sure that people understood, and that is why the initial or the information sharing and the way that we went into the regions and educated the people was important, so they understand what it was. I think what I would touch on last, perhaps before I give to Matt, if there's anything, I would say the distance when we were trying to get the data from the regions, or when we sent out the questionnaires, when we were collecting the data, the distances between some of the regions or the villages and the towns and the cities was a bit of a challenge. So we really had to sometimes wait to get all the data together so we can be able to analyze it, so that Matt's office could analyze it and make sense out of it. So I think the distance was also a bit of a challenge at the beginning. We had to wait for some of the questionnaires that were sent in faraway places. But yeah, maybe I can give over to Matt to share some perspectives. Thanks, Manuela.
Thanks so much, Robert. Yeah. It looks like we might have some issues with Matt's internet connection. So we have one last question, that's for Nicolette, regarding the parenting program, whether parents are receptive to the program, and if there are challenges engaging the parents and differences observed among mothers and fathers.
Definitely, the parents were very receptive, because part of the process, we also did some pilot sessions in 9 of the 14 regions in the countries, and where we had different sessions from different cultural backgrounds with parents, and they were really eager to participate and understand. And even through that process and piloting the manual with them, they were very surprised to understand some of the issues around children. And there was one particular parent that was sharing that she couldn't understand the behavior and the growth of one of the children, and eventually to understand the alcohol syndrome that we addressed through the manual, she could understand the behavior and the growth of the child. So it was very enlightening for the parents to understand the different stages of development. They want to learn more, they want to engage more, they're looking forward to more engagement to really roll out the program, because the program was not piloted in a full detail, but more sessions that we need to facilitate with them. Definitely the fathers were there. The fathers were fully participating during the pilot phase of this, of the piloting of the program, and very eager to get on board. And in the country in particular, there's a lot of conversations that are going around the getting men involved and get the boy child also involved. So yes, they're very receptive to this and looking for more. And we've developed in the IEC material very easy, user-friendly material. We had radio jingles that will be aired in the country. There's some videos that has been made, and a lot of easy reading material also for the parents, because in some of the areas, the parents' education level is not that very high, but illiterate in some of them. So there's a lot of interest and participation to go forward and want to read more and understand, in particular around the rights of the children, also the reasons why we developed and further developed a more simplified version of the Child Care and Protection Act. Because what we also gathered is that parents do not understand the rights of the parents and of the child, and the confusion out there in the community. So through these jingles and through these radios and infomercials that we did, we hope and trust that more information will be then made known to the parents and create more conversations in the respective communities. Over to you.
Thank you so much, Nicolette. This is fascinating. I want to acknowledge other questions from the audience in the chat box, but in the interest of time, we need to move to the government panel. So I want to reassure that we will follow up with responses by email to the questions. So thank you very much, and feel free to post further questions as you see fit. So now it's with a great honor and pleasure that I welcome our government discussants. So we first have Mr. Julius Natangwe Ngifikwa, who is the HIV/AIDS management from the HIV/AIDS management unit from the Ministry of Education in Namibia. As mentioned, the government of Namibia led the Violence Against Children survey implementation in 2019. We then have Mrs. Beatrice Muyambango from the Zambia Directorate of Child Development and from the Ministry of Community Development and Social Services. The government of Zambia led implementation of the VACS in 2014. We have Mrs. Vivian Mangoli from the Kenya Department of Children's Services from the Ministry of Labor and Social Protection. Kenya is a country which conducted 2 VACS, one in 2010 and another one in 2019. And finally, we have Mrs. Alice Umurewa, who is the Chief Social Worker at the Namibia's Ministry of Health and Social Services. So we apologize, we don't have Vivian and Alice on the slides, but they are very much with us. So I want to turn to you, so our government representatives. When you see these 4 presentations, some in your countries and some in others, how this fits with your national strategy and efforts in this area. So I'll hand over to Mrs. Vivian Mangoli from Kenya.
Good evening in Kenya, good morning in America and the rest of the world. Manuela, kindly repeat your question.
Sure, yes. We'd like to get your reactions on the 4 presentations that we had. And if you could tell us how this presentation, the lessons learned, the findings, the activities fit in your national strategy and effort in ending violence against children.
So just the way Anne highlighted earlier, that through the VACS survey that we conducted in 2019, we were able to develop a national prevention and response plan on ending violence against children. And this plan has 6 strategic areas that we seek to implement that are aligned with the INSPIRE strategies. And the presentations that were done today fit in each and every strategic area that we have. For example, what Anne highlighted is mostly what we have highlighted as actions in the strategic area number 6 on coordination, because we identified coordination as an area that really needed to be worked on to ensure effective implementation of programs. And it was important for us to ensure that actors are aware of the plan, are aware of what the survey results were, and are also able to entrench the actions that are contained in the plan in their respective work plans and are reporting on the same. I like what Namibia is doing with the school safety program, and it also it's a lesson to learn for us, especially in our education sector, because we have a strategic area number 3 on education and life skills, and we are working with the Ministry of Education to implement the actions contained therein. And so what Namibia has done in school safety is a point to learn from. Implementing parenting skills and economic strengthening is also another strategic area that is contained in our plan. And what Namibia is doing, again, may be a lesson to learn with what Kenya has already done, because we already have a parenting program in place that is being implemented, has already been piloted, and there are plans to scale that up. So this fits very well with our plan, Manuela, and we are looking forward to evaluating what we have done so far in a bid to just extend the time period of implementation of the same. Thank you.
Thank you so much, Vivian. Thank you very much. I'll turn to you, Beatrice, to have your reactions on the 4 presentations and to tell us as well how these fit, how the content of these presentations, fits with Zambia's national strategy and efforts in ending and preventing violence against children.
I was saying good afternoon in Zambia. We are an hour ahead of Kenya. Given time, would have presented on what Zambia is doing in order to curb violence against children, which eventually translates into the upholding of children's rights. But to answer your question, we are more or less the same, except that others perhaps are a little bit ahead of other countries, and some countries are yet to be there. We seem to be doing almost the same things because summarily, we are all actually in the active observance of international legal frameworks to which we are signatories in order to uphold the rights of children. And we also have our own legal frameworks, national frameworks, domestic frameworks that have actually, or that we have developed in order to curb violence against the children and uphold the rights of children. In Zambia, so far, after our endorsement to the United Nations Convention on the Rights of Children, we also endorsed our signature to the African Charter on the Rights of Children. And that alone, perhaps, may not have fitted well to the specific Zambian situation. So we enacted a code, Children's Code Act number 12 of 2022, which specifically talks about and encourages national observance on the rights of children. So this is our Children's Code Act number 12 of 2022. Now, this one sounds like, or looks like, or perhaps I may say, is not actually very easy for a lay person to use and understand, because it's so legal. It's well understood by the lawyers, but for the ordinary person, it's not very easy to use. Because of that, we have developed and launched what we call child safeguarding framework, child safeguarding policy, child participation frameworks, child safeguarding policies. And right now, we are actually editing the Children's Code Act, a child version, which is pictorial and very easy for the child to use. Other than that, that is for the children, for them to know their rights so that they can stand and speak for themselves in issues that concern their well-being. But other than that, we have also simplified further the Children's Code Act, and we call it the simplified version, so that anyone can pick up the frameworks, the legal documents, read, and then understand for themselves. These acts actually, we realize that children are all over. You go to church, you find children. In the schools, you find children. In hospitals, you find children, wherever they are. So Zambia, under the Ministry of Community Development and Social Services, is actually encouraging all our line ministries, those that we work with, like the judiciary, education, health, police, to develop each their own sector-specific framework, so that when children go to the police, if at all they found themselves in such a situation, the police will know how to handle these children safely and then uphold their rights. If it is in a school, the school also should have their own, education should have a sector-specific version of the act, so to say, so that they know what defines safety for a child, what defines violence for a child. We did all that basing on the fact that most of these violences against children's rights, they happen in very, very familiar environments. A child will be abused right there in the home, and the mother sometimes does not know, and many family members do not know. A child will be abused, their rights violated in a school with such a very big population, but no one would be aware that this child is being violated in whatever way. Even in churches, we have had situations whereby very, very unlikely situations, sad situations, children are violated, children's rights are violated right there in the churches. Sometimes boys are sodomized. So we are encouraging a situation where this act rolled out. So far, we have rolled it out to 6 of our provinces. We are remaining with 10. So that when all is done, people are informed.
Right.
Everyone who comes into contact with the children will have knowledge to say these things are happening here. And when this and this is done, this is violence. When this and this is done, it entails that children are not safe at this particular environment.
Thank you, Beatrice. Thank you so much. Thank
Yes.
you so much for sharing Zambia's experience and the discussion as well of the Children's Act. In the interest of time, I know we've run out of time. I want to apologize to our audience, our participants as well. For those who can stay a few more minutes, I'll hand over to Alice from Namibia as well, so she can share her reactions from the
yes.
And then we'll go to the Thank you so much. Over to you, Alice.
Good afternoon. Can you just confirm if you can hear me?
Yes, we can hear you.
All right. Thank you so much. From listening to all the presentations, it's very clear that our situations as SADC, as Africa, is not really different. We are all experiencing the same things, the same scenarios when it comes to children, and especially violence against children. And Namibia in particular, we noticed that when we started with all of this research, with all of this data that we were collecting, we noticed that our children can only be protected when we all hold hands. Hence, all the stakeholders need to know what is their role. We need to stand together, and it's the only way that we will be able to really protect them. And I like particularly the fact that the Ministry of Health, the Ministry of Gender, as well as Education, who are all at the front line when it comes to children, are already together, and our other stakeholders are all holding hands. I really have to speak about the challenge that we have with funds. When Nicolette was presenting about all the IC material that we need to print and how we need to disseminate this information, as well as raise awareness. So we really do need that support. And if we can get more stakeholders holding hands with us in this battle, then it will really be good. But I think Namibia is on the right track. We are moving in the right direction. And it's good to network like this so that we can continue helping each other, and the challenges that others are facing with, maybe those are challenges that we have faced with, and we're also able to overcome, and we can be able to share our success stories. Thank you very much.
It's fantastic. Thank you so much, Vivian, Beatrice, and Alice, for sharing your country experiences. Thank you, Alice, for raising the importance of resources and joining hands between stakeholders. So that was a great panel from our government voices. So I'll hand over to you now, Andrew, for the remaining parts of the webinar. Thank you.
Thank you very much, Manuela. To wrap up our webinar this afternoon, it is my rare honor and privilege to introduce Ms. Jennifer Waisanga from USAID in Kenya to give some closing remarks. Madam Waisanga, the floor is yours.
Yeah, and I'm really thankful and grateful to all the participants for sharing their lessons. As I sat our concept paper as Kenya, working together as a team with the Directorate of Children's Services, Vivian here, and together with the UNICEF team, and discussing and agreeing how would we want to move this process forward. I'm so excited to see that there are fruits that have been born out of this great collaboration. I'm also very happy that we've been able to, looking at what we've all presented, be it Kenya, be it Namibia. So what I was saying is that what I'm happy about is that we're really building on our evidence base and using various information systems to be able to address issues around violence against children. And for us, especially here in Kenya, what we are happy about is that even though we know for USA, the US government has been implementing orphans and vulnerable children's programs across 25 counties. And I was glad that with the direction from the Directorate of Children's Services, we're able to expand and be able to disseminate the VAC and the National Prevention and Response Plan in the other additional counties that were mentioned by both World Vision and also with Liverpool. So we know as many as possible Kenyans are really aware about the VAC, and very many people also are aware on how to mitigate and also address. And all this is not just at the national level, but also all the way to the community level. So as our next steps, because I know we are way over time, one of the things which we are happy about as a next step is having hosted the International Child Protection Conference led by the Directorate of Children's Services. We're happy that one of the keynote speakers and issues that were discussed in the conference was about the qualitative study which came out of part of the activities we are discussing in this webinar. And we are looking forward to also having this organized and shared with all our implementing partners so that they can see where else can they plug in so that we can have much more reduction and mitigate impact of VACS on children. And also ensuring that we all continue aligning with the governments, whichever government and whichever part of the world we are in, because we know they are the custodians of the law. They're the ones who can reinforce the law and enforce the law and be able to ensure that we're following these guidelines. We are reporting and supporting the one government reporting system so that with that then, as I had us speaking about importance of financing, especially child protection issues, then the government has also a basis of being able to see what we are all doing as different implementing partners if we report using the one government reporting system. And for Kenya, for us, is the Child Protection Information Management System. So without much ado, I'm really grateful to all the teams for openly sharing their lessons learned, the challenges they went through, and also their next steps in terms of ensuring that we continue supporting children as duty bearers. So without much ado, thanks so much, everyone. And I look forward to sharing what you have actually shared here with my colleagues as well in the office. Thank you so much, and back to you.
Thank you very much, Jennifer. Thank you for those very important words. Ladies and gentlemen, we apologize for having shot beyond our time. As we end, just a couple of announcements. The first one being that the recording will be sent to you in the next few weeks. And secondly, there will be a survey on your screen soon after we log off. Please take a few moments to just give your feedback on this webinar. And lastly, please look out for the upcoming webinars in the next couple of months. Thank you so much for your time. I hope you have gotten one or two things from the session that we've had. And please enjoy the rest of the day. Thank you so much.